you'll be with us, that all of our decisions will be made in accordance with your values and our oath of office. We pray for the county. We pray for the people within it, that you would bless all areas. In your name we pray. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, could I have the roll call, please?
Commissioner Nosker,
Present.
Commissioner Glover,
Here.
Commissioner Bothell.
Present.
Okay, adoption of the agenda. Are there any additions, corrections, or deletions to the agenda?
I have none, and I move that we approve that we adopt the agenda as presented.
Second.
Okay, the only change I have is today is Thursday, November 12th, not Wednesday.
Oh, thank you. I will make that change.
Okay, we have a motion and a second. All in favor?
Aye.
Right.
Aye. Okay, public comment period. We have any members of the public who would like to have a comment? They have 3 minutes. No action will be taken on anything. Are there any members of the public that wish to speak at this point?
Apparently not.
Okay, we'll move on then to the consent agenda. Are there any additions, corrections, or deletions to the consent agenda?
I would like to make a comment is on the, now that Judy is posting our entire packet to the internet, I think it would be appropriate on the minutes to write draft
Yes.
over them.
Yes.
And it was not.
And you can't access that link. I tried this one. It says Google Drive, but you can't click on it.
It worked on yesterday when I posted it.
Yeah, Ryan had asked about.
I'm
what
wondering
this
if
was
it's
gonna
not, because today it's like 119 pages.
be. I don't know.
And so I
It
wonder if
shouldn't
it's just
matter.
such a big
It
file. I
shouldn't
don't know.
matter.
Because Ryan had asked what time to call in. I said, well, I think it's first on the agenda, but I said, let me go look. So I went to go look. That's why, and you couldn't get into there. And so it shows the Zoom link and it shows a Google thing, but you can't click on it. So.
And it brings it right up for me.
And so sometimes I know that used to happen is that you guys could, but like outside people can't. So you might have somebody from the outside test it to make sure.
Okay. Yeah. Interesting.
And I know with like our state computers, the whole box don't always work, so it could be that as well.
Okay, how was that resolved? It got muddy there.
Pardon me?
How was this resolved? I couldn't hear what was being said.
Oh, it looks fine on my end. I'm gonna have to do some tests with citizens outside of our network to see what the issue is for that. And it might be one I need to get technical help with, because it looks to me like it's coming up just fine.
Well, and I tried pulling it up from my other email account, and I had to download it in order to be able to get it to open.
Well, and that may be your email restrictions.
I don't know, but
But if
from
you
that
go straight
standpoint, it
to
works.
to your county email,
From the county, yeah,
It
it's fine.
should,
It goes
yeah.
directly there. But I was saying I went from another
From
email to
another,
test it,
okay.
and I had to
We'll
download
look
it
at
before I
that a
could
little
get it.
bit more.
But I do think it does need to say draft on the minutes.
Yes,
And
and
so,
we'll direct that for our recording. right there.
okay,
Okay,
beyond that, I have no corrections.
okay,
on the
thank you.
Minutes that were on the.
Any other comments on the consent agenda? If not, I'll entertain a motion to approve it.
So moved.
Second?
All in favor?
Aye.
Okay. Then move on. Now we run into the Journey's Board of County Commissioners. I see Ryan is away from his computer right now. Judy, I'm not quite sure how we're supposed to do this. Ryan, maybe you can help out. This is sitting as the Board of Health and Commissioners simultaneously. We have here basically adjourn as Board of County Commissioners and call orders Board of Public Health. Is that what we need to do?
Yes. Oh, and Ryan's here, so I'll let him direct you.
So you don't necessarily need to adjourn and call up as the Board of Health. That resolution states that anytime you sit as the Board of County Commissioners, you also sit as the Board of Health.
Okay. The only question then is for the purposes of maintaining the minutes for the Board of Health, which are separate from the Board of County Commissioners. I defer to the experts on how we should do that.
I think the past practice of minutes has been clear.
Okay. Question I have on that. Where do we keep the Board of Health minutes?
Those, I believe, have been maintained by the Public Health Director.
Okay. Thank you.
I will say that, this is Deanne talking, I have given them to his staff after they've been approved and signed.
I'm sorry, I missed that, Deanne.
I have given them to the public health staff after they've been approved and signed.
Okay, thank you.
This
In
is
that
Dr.
case,
Bancole. I'm trying to still figure out where the files are. So once I'm able to locate them, that should be fine.
Somebody say that again for me.
We're good.
That was Dr.
Good.
Bancole, and he said as soon as he finds them, he'll be good.
Okay, sounds great. Thank you. Then we'll go ahead and get to the Board of Health business. We have two items. Item A, consider changes to the Healthcare Coalition Coordinator contract, and we'll start with that. Ryan, do you have comments?
The only comment that I really have, having not heard any of the other discussion, is that it's my understanding that the steering committee for the Healthcare Coalition has made a recommendation or has provided guidance to the Board of County Commissioners recommending that the contract with Cynthia Ford be terminated. The contract provides for termination with or without cause, giving 2 weeks notice to Cynthia upon the recommendation of the steering committee. And so, having received that recommendation and being apprised of the circumstances, it's my recommendation to the board that they accept the guidance provided by the steering committee and terminate the contract.
Okay, thank you. Are there any other comments on that?
I guess my concern is that this might be a little bit short-sighted because there are the deliverables that need to be done quarterly. And do we have a method or a person or a manner to continue that so we don't have a hole?
So just so you know, Suzanne, the steering committee will be meeting this afternoon at 2 o'clock to come up with a plan. I did speak with Kurt at Public Health late Tuesday night after the recommendation was made. Kurt is very willing to work with Dr. Bancole to come up with a position to do that. But in light of the issues, honestly, the steering committee, and Cynthia was present and Cynthia can say what she wants, has no confidence in her ability to fulfill those deliverables. As you know, last year during those deliverables, they were not completed. That was part of the reason for the recommendation to terminate it. So they're not confident even keeping her, we would be able to do some of that given the situation the steering committee has had.
But we do have a method.
We
Or-
will come up with a method at 2 o'clock this afternoon is what the plan is. So
I'll be joining the meeting today, and then part of my journey in the meeting is to understand what the scenarios and whatever options we have on the ground. And also for me to be able to understand what the HCC does within the region and how we then have to move forward in meeting all the deliverables by the state. So if we have a termination of contract, then we should have a plan moving forward. And part of that is what I'm going to be doing today at the 2 o'clock meeting.
Okay.
And Jody, isn't it also correct that the Colorado Department of Public Health and Environment has said that they're understanding of the concerns with respect to the contractor and this particular contract, and they will work with the steering committee and the HCC on those deliverables that are needing to be met on a quarterly basis?
that's correct.
Thanks.
Okay, I just want to make sure that we're not going to put ourselves in a position of not finishing
And-
something.
Unfortunately, Suzanne, with what happened and the lack of confidence, that shouldn't be the decision-making of keeping Cynthia. So it really, the stuff that has happened is severe enough that even the state is like, you guys need to terminate this contract.
So without knowing the full details of what has actually really happened, it might already be that we're already late on some things. So if we're already late on deliverables, or we're not performing our fiduciary responsibility or the work that we're supposed to do, then there's a need for a new plan on how to meet and mitigate the issues. So I totally agree with you. We might need to come back again and give you an update as per these are the plans to clean up the mess, and these are the plans moving forward. And that is the attitude I'm going to get into, trying to understand what really is going on. Because the information I have right now is that a contract has been terminated because of non-deliverables. So what are those non-deliverables? And to what extent can we really meet those deliverables and not tax the patients of the state? So I think there's a need for us to come back and say, okay, these are the issues. These are the plans moving forward.
And just so you know, Suzanne, the steering committee is going to have to step it up. The members have said they are very willing to do that. If you guys chose not to terminate Cynthia's contract for whatever reason today, you will probably lose a lot of your steering committee members for it. It was a 10-1 vote very strongly in that this contract needed to be terminated and a new plan needs to be done.
Okay, I just wanted to make sure that,
Oh, no, this isn't going
that
to
there
be easy.
is a,
Yeah, and honestly,
Contingent plan.
just so you guys know a little bit of a history, we met with Cynthia. You guys were invited to that meeting. Jean and John participated in it with the steering committee meeting with our concerns with her prior to this a couple of months ago, trying to work this out. She was very aware of those issues on that date. And so we have already tried to work this through before it came to this point, because we wanted to see this through and wanted to try and make it work. But at this point in time, the steering committee does not believe that this is a workable situation. And I don't know, I will offer, Cynthia's here. I'm not sure if you want to speak to the board. I want to make sure and give you the chance if you want to do so.
Sure.
You'll
Can you-
probably
can
have
you
to
come up here so the Zoom can hear
I'll
you?
move.
Yeah. It's just fine. Right here.
Whichever, it doesn't matter.
So in regards to the deliverables of last year, state did come out with a letter that I did forward to Trish and Tony so that they could have the paperwork to show that the fourth quarter was pushed into this new fiscal year. And the deliverables per that conversation were pushed. The state did give us lenience. They were completed and then they were turned in the month of October.
And was that pushing because of COVID? Is that,
Yes,
do I remember that?
yes. They moved them because of COVID, because of everybody being busy with COVID. So they also canceled some of the exercises that we had to have. And that is all stated in the email from the state.
So
And then in regards to the deliverables for this year, they have been completed. The steering committee will need to look at the crisis standard of care, which they have 30 days to look at that. And they also have the sustainability document, which they will be looking at that. I will be putting those out today for them to look at. I have completed those. And everything else is on time. The only thing that we did get a waiver for was the strategic 5-year plan. And the state approved that and sent an email to the steering committee and me saying that we were allowed to do that. And then the steering committee voted to have all clear emergency management, do a contract with them so that they could do the strategic plan for the HCC. And then also for deliverables that they wanted to see, I put them in an Excel spreadsheet that showed all the quarters, what was all completed. And for this coming up meeting. It'll show all the other deliverables that are completed and what the status is on where everything is at.
And all of the ones from last year that were pushed, those are all completed?
Yes.
Okay.
The ones from last year, the,
That's not true. Yeah, and I will tell you, right now, there's a $45,000 amount from last year that got pushed over. That is not finished because we just finished it this week. We do, even as like a board of county commissioners, you haven't received the paperwork to expend that 45,000.
And
So
is
it's not
that-
possible that these are
Is
done.
that the same 45,000 that wasn't finished
Correct.
last year because it was stipends?
Correct.
And then we determined that the stipends were not appropriate.
Partially,
And
yes.
then the state said we can buy PPE.
Correct.
But the steering committee couldn't ever decide on what they wanted to buy.
Well, there's been reasons. It wasn't that the steering committee couldn't decide. There's a lot of that goes into that, Suzanne. And honestly, yeah, this 45,000 is still on the table. You guys do not have the paperwork from the state. That is not complete.
And so we
So-
haven't lost it. It's just not
Correct.
completed
But-
yet. And so, okay.
But those deliverables are not met. Just that 45,000 alone, I can tell you, is not done because you guys don't have the paperwork. Steering committee had to decide what it is. We just finished what that was. It needed to be sent
Olivia Romero.
for the state to send it back to us so you guys could disperse those payments. None of that has been done. It may have been sent to the state, but we don't have the paperwork back and the payments have not been dispersed. So you cannot say that those deliverables have been met at this point in time. And I'm gonna be honest, I don't feel comfortable speaking on behalf of the steering committee. I'm just one member of the steering committee. They have made a letter very clear to you guys that they think this needs to be terminated. I will tell you on my part of the billing issue that's going on, it's very severe what happened with it. I'm just doing my job as the fiscal piece to correct it. And so I think that's what's before you. If you guys don't feel you want to entertain what the recommendation from the steering committee is today, then I would recommend that we have a meeting jointly with them to move forward. That way everybody can be present. But I can tell you that is not an accurate statement that the deliverables have been met.
Is there any other discussion on this?
Yeah, I just wanted noted that 45,000 included the stipends that the steering committee was supposed to receive. Then when you found out that they were not supposed to be getting that from the state, then that caused a big hiccup.
Ryan, do you have any other thoughts on this? I mean, we have two issues before us, or we're only dealing with the one, which is probably the more crucial one in terms of terminating the contract. Do you have any other comments on this in terms of the contract?
Well, in terms of the contract itself, I don't think there was transparency in the contracting process. I sent an email to the board yesterday whereby I explained that there were multiple emails from the then acting public health director, Tony Stephen Stewart, indicating a contract rate of $58,250. And that was sent to the board and to myself for review. I reviewed, I made corrections to what I think was a fairly sloppily prepared contract, in that it was used from carried over from previous years. The terms hadn't been updated from 2019. I made recommendations to Tony that we update the term. I received an email back indicating that those corrections had been made. I also reviewed the recording of the July 29th Board of County Commissioners meeting and the public health section when it was recommended that the board approve this contract. And while there is a reference that Tony made in that meeting that the contract amount includes additional expenses for travel and any other expenditures occurred by Cynthia, there's no specific reference to an increase in the contract amount by $8,000. And there was no reference to a specific amount. And so when I reviewed the minutes from the Board of Health that had been corrected by Commissioner Bothell, it reflected an amount of $58,250, evidencing that was at least Commissioner Bothell's understanding as to the contract rate, and I presume the board, in the board's understanding as well. In that meeting, you, Commissioner Nosker, also made a statement that you had not seen the updated contract. You were relying specifically on Tony's recommendation that we approve the contract, but again, there was no mention that the contract amount had changed. So I have concerns that 2 hours before that meeting, a new contract was proposed to the board with an increase of $8,000, and there's no mention whatsoever of that increase. And I think that it would have been prudent and ethical to have specifically brought to your attention an increase of $8,000. That being said, the contract also provides for that $66,250 amount as a not to exceed amount, and for it to be billed for that 12-month period, not to exceed $66,250. What is in fact occurring, as I understand it, is that $66,250 is being invoiced monthly on a 1/12 basis. And so the contract doesn't provide for billing or invoicing of 1/12 of that amount. It provides for invoicing and billing of her actual time and expenses not to exceed $66,250 per year. So in terms of the contract and how it's being applied, I have concerns about how the invoicing is occurring. And I think that's leading to, my understanding is that is leading to the lack of confidence that the steering committee has in Cynthia Ford's ability to carry out the contract. Additionally, with respect to those deliverables that weren't met in 2019, it was my understanding, and I wasn't present at those meetings, but it was my understanding that Cynthia was requesting an additional amount to complete the deliverables in the first quarter of this fiscal year. And so again, it's my understanding that that was leading to and contributing to the lack of confidence that the steering committee had, and part and parcel of their recommendation to terminate the contract. But Jody, I'll let you speak to that since you're on the steering committee.
Yeah, no, that's absolutely correct. And, you know, during the July 21st meeting, and I asked Cynthia this on Tuesday if she was present, there was probably at a minimum a 45-minute discussion about the wages. Cynthia had submitted a budget to the state that the steering committee had never approved with increases to the rate. That was the amount they came back. The steering committee was absolutely against in giving an increase because the deliverables were not met the prior year. And so they were like, look, we will do the 58,250, the 1/12. You have the ability to submit other documentation. That is not got in the contract. I wasn't present. That wasn't my dealings. I don't know what happened with the contract. But like I told you guys the last time I met with you, I was going to meet with public health staff, and I did. Public health staff was asking questions of why she had gotten a raise. How did they know that this was the right amount? That's when I started looking for the contract. And when I discovered all of this stuff was not matching up to what the intentions of the steering committee was to be. And Cynthia, she said that in her statement to the steering committee on Tuesday that she was not involved in the contract. I disagree with that statement as well. She signed the contract, and I told her on Tuesday as well, you do have a due diligence when you have a personal gain from a contract to bring that to the attention. She should have done, in my opinion, what I did, go back to the board or steering committee. And that is what was before the steering committee on Monday, is 3 choices. They could either ratify the contract that got whatever it is and live with it, or they could have come back to the board to amend the contract to what their intention was, or they could have terminated it. What ended up being was a long conversation about the concerns of the deliverables, different concerns of not being communicated with. Again, I'm part of the steering committee, but I don't fully want to talk on their behalf, but there is a lot of concerns with it. And ultimately, this was just the last piece that they were like, we don't have confidence because of this. And it is a personal gain, and it never should have been paid or that way when it wasn't the intention of the steering committee. So to me, and you asked Suzanne what happens with keeping her, I have a bigger concern of liability issues because of seeing this stuff and seeing things not being done the way it should be. You're opening a bigger liability on that piece of it.
Okay, and I went back through the emails and pulled up last year's contract, which was the 66.
Correct. And the reason it was 66 is it included the travel and the mileage and all of that.
Correct.
The steering committee had made a decision not to do that full amount. They did the full amount with the intention, if she did travel, if she did have mileage, because due to COVID, probably not doing any of that, that she could submit proper documentation to draw that down in addition to the 58,250. It was never with the intention of the full 66,250.
And I also want to point out that that meeting of the steering committee took place on July 21st. The first email that came from Tony was sent with the 58,250 was sent on July 22nd, was sent again on July 24th. And so if she was relying upon the recommendation of the steering committee, then it should have included that information from July 21st, but it didn't. And the amount proposed in that contract was $58,250 and was only changed 2 hours prior to being approved by the board on July 29th.
And what I put in front of Commissioner Bothell as well is Cynthia's invoice from July 22nd, the very second day after the July 21st meeting, where she did bill correctly for 1/12 of the 58,250. And it wasn't until the August billing that she decided to increase the billing. So at that point in time, one day after the meeting, Cynthia did know what the correct amount to bill was of the intention of the steering committee.
So what was the intent of the steering committee as far as her expenses? Because I do know she's a contractor and not an employee, and so she has to cover all of the expenses. And
So that's where she would have had to submit proper documentation if there was any expenses that she wanted to be covered. And that would have came out of the $8,000 additional funds. But honestly, Suzanne, this becomes a viewpoint of what the contract should be or not be. We could have been having this conversation, but frankly, the steering committee, they're done. That's why you've got the formal recommendation to terminate this contract. So I don't think it really at this point is even a matter of what the contract should or should not be, is the fact that they are asking the board to please terminate the agreement with her.
And as a contractor, she cannot bill for or invoice for expenses she has not actually incurred.
Correct.
Okay, or is there any other comment on this before we move on? We're gonna have to take action on it one way or the other.
One other thing I just wanted to add in terms of looking at the future in terms of contracts. In my discussion with my staff and a couple of folks, it appears that copies of contracts are either, not initial on every page, so that if there's any changes in the middle of putting the papers or the contract across to the commissioners, they will know which particular edition was the final. So my proposal is that for us, one, every contract, before it gets to the commissioners, they should be signed by the head of department, and they will move on to be reviewed by the legal department, and also the finance department to be sure everything is in order. And then by the time it gets to the commissioners, they will know that multiple eyes have seen it, and multiple initials of each person have seen it is already appended. And then they are signing what everybody have seen. So there won't be all these, misconstrued perception of this is an amount that I should be getting, or the other amount that I should be getting. And two, that when things surface like this, it will just be easy to deal with right away, rather than wasting the county commissioner's time trying to wade in with specific questions that should have been dealt with right from the beginning. So that is just my little suggestions to moving forward.
And I agree fully with his
that's the
suggestions.
lesson learned, is I think it is a good idea. And I think if that would have been done, then it would have been easier to track.
This would have been caught way sooner than when I had to just help to do the quarterly report. So
Well, and I think, and that goes back to transparency. It goes back to having complete documentation.
Yeah.
And I think that's part of the problem, is that the documentation was not complete. Who did it? We don't know. And that's kind of probably neither here nor there at this point. But
And normally, ideally, contracts, there should be 3 copies. One with the head of department, one with the finance, one with the legal department. The county commissioners doesn't need to have a, if you do, then you can keep a copy, but you will rely on those head of departments. You need a copy. So everyone will have a synchronous, harmonious contract on file. If I'm not there, if I don't have a copy, definitely the finance department will have a copy. The legal department will have a copy, and definitely something, if anything is wrong, they will all figure it out before it gets to you. you got a lot of things to look at and make decisions on. But if you don't have evident factual information before you, we'll be trying to weed out the facts from the weed.
Thank you.
And-
I heard somebody start to speak. Go ahead.
I guess I'm gonna say that if we've got a recommendation from the steering committee that,
It's in front of you, Suzanne, if you want to
Yeah.
read the recommendation.
I don't know that it would be prudent for us to not approve their recommendation. And I guess the presumption is that they did their due diligence and that they did everything they should do. And that at this point, if we didn't approve the recommendation, it would serve no purpose. So,
Well, I think the steering committee has done more than just maybe prudent part. I think they've studied this pretty hard and long, and it's been a lot of hours, and there's been a lot of phone conversations back and forth among themselves trying to figure out where all this stuff was at. I just don't see any reason not to accept this. I mean, we got the signatures right here in front of us of the ones who are involved in it, so.
Thank you. That being said, the commissioner is ready to take action on this, and if so, I would entertain a motion.
So moved.
and I
Okay.
would second that.
Got a motion and a second. Gene Glover moved, Suzanne Bothell seconded. Is there any further discussion at this point? Hearing none, I'll call the question. All in favor?
Aye.
Okay, motion carries.
So John, just for a clarification purpose, and since Cynthia's sitting here and Steph and Ryan, I'm going to make an assumption you will write a formal letter to her terminating this contract and giving her the 14 days notice that's in the contract. And also then in turn, Cynthia will need to make arrangements with probably the co-chairs to return all information, data, everything. I'm sure this afternoon that can be discussed, whether they want it or Dr. Van Cole wants it or whoever needs it. But I know there's a lot of documentation on Google Drives. There's been meetings that have been recorded. All of that stuff will need to be, communicated to the appropriate people.
These will be turned into Rio Grande County because Emily purchased them under you guys.
Okay. And that was the only thing that you had that was, that belongs to Rio Grande County?
There is a printer and that will also be turned into.
Okay.
And we can make a plan. I don't know if you're calling in this afternoon, Cynthia, what you're planning on doing. Technically it's the 14 days. I think it would make a smooth transition, but I mean, I don't know if you're under obligation for that. So that's totally your call. It would be easier if you are, but if you're not, I respect that as well too.
I'm planning on it.
And then we can.
So my assumption is that Ms. Ford will return any county physical property that's in her possession, in addition to all files relevant to the HCC contract.
At the end of the
However
14
form
days.
that's done.
Yeah, and I'm not sure the specifics. I didn't look in the contract. I don't know if you know, Ryan.
I have it open in front of me.
My guess isn't if the contract continues for 14 days, that she would be expected to work for 14 days and would need the information in order to do that.
That's what can be decided this
I don't know.
afternoon. That's a bigger question than me, Suzanne, and even Dr. Van Cole. I think that's why the steering committee's meeting this afternoon is to make a plan to move forward on a transition so we can meet the needs of the deliverables and how we're going to do that. So I wish I knew ahead of time, but we don't. It just needs to be decided this afternoon.
Okay.
Any other discussion, Ryan? Do you have a comment on this, or are you good with what you're hearing?
I'm fine with what I'm hearing. I'll review the contract in terms of the time frame. I'm just trying to look over it right now. In terms of returning, it does say that upon, it says in such event, and doesn't necessarily say upon the termination or upon the notice. And so I'm not comfortable with that ambiguity. But anyway, it says all finished, unfinished documents, data, studies, reports prepared by the coordinator shall become property of the county. And then all drawings, specifications, guidelines, policies, and procedures prepared by the coordinator in connection with this agreement become property of the county as well. And so makes sense that all property, physical property would be returned to the county prior to the expiration of the 14th day, but also any intellectual property as well.
So the public health director, Dr. Bancola, the steering committee, you can determine how that's going to be taken, how that'll take place. I'm assuming that if we're going to continue working with CDPHE over the next 14 days, there'll be direct communication between Dr. Bankula and CDPHE, and it might be useful to have those files available to him at that point.
Yeah, and Kurt was hoping to join the meeting today or the one this afternoon. His schedule just did not allow him to do so. And so we'll set up a time frame. And this leads into the second part of what's on your agenda is the fiscal piece of this. As you guys know, I did volunteer since I was a steering committee member to help you guys while we were, in the process of getting a new public health director. So we were just trying to, do that. I think this is the perfect time to figure out what we're going to do. I think he's a vital part of making how we're going to move this forward. And so I would ask at this time that we transition the fiscal piece back to Dr. Bancoli as well too. But I will help him. I'm not going to just step away. I have the prior knowledge and the current situation's a little difficult. And so I would never do that to somebody. And so I will help you do this until he feels comfortable taking it on his own. Go from there, because there is a lot of outstanding items with the prior year deliverables and the current year deliverables, being the 45,000, the 25,000 COVID money. There is a new 95,000 we need to do. So I'll work with him with the knowledge I have to do that. But I think it is a thing that we need to get it back into public health where it belongs. And moving forward, he's a vital thing of which direction he wants to see this go.
Okay, thank you. Is that clear then that Jody is stepping aside? She was handling the transition as the healthcare fiscal officer, if you will, for the county. And now she'll be turning those back over to Dr. Bankula, but she will assist him in that process.
And I think that's a good idea that he handle all that, but kind of to refresh some memories is in past years is public health had held their grants very tightly, and so nobody else in the county knew what was going on. That information still needs to be shared with the financial departments, and so we can ensure that no processes are changed where that the invoices and stuff don't come up to the financial office.
Well, and that's what he was telling you guys earlier with the contracts and stuff, that it should have a copy in finance and a copy. So I don't think that's his intention.
No, I don't think it is your intention. I think you understand that, but I want to make it clear that we want to make sure that it doesn't go back to how it had been in the
previous
past.
status quo. No.
And where everything was hidden and that the finance department didn't even have access to invoices or anything like that. And so that's my only.
Yeah, it's even surprising to me that there will be, kind of like a gap or, a gap between the head of department, the finance department, and then the legal department. They're all supposed to be working together, because if there is a problem, well, finance department will come to your aid. The legal department will defend you. And that transparency, once it's built up, all this will not even be coming to discussion, because it's all flat out clear. That's what the way I've always operated is there'll be 3 copies. Transparency, communication. One with me, one with the finance department, because it's all about fiscal responsibilities, and one with the legal department. If the county commissioners want 1 copy, we'll give them 2. No, that's the truth. So there wouldn't be any disparity. If there's any disparity, the one that trumps, and I'll say right away, the one that trumps everything is the legal department copy. Because before it comes, the final place to reach before getting to you is the legal department, so that every language that is there, they know the one that can withstand the test of the court. So let me not
And
belabor the issue.
I think you truly understand. I just wanted to make sure we did have this conversation along the way and it wasn't just some presumption.
And I appreciate that, Suzanne, because if that would have been the case, I wouldn't be in the position I'm in, having to do a very difficult thing that I didn't, want. But, it's just doing the job and trying to do the quarterly report. It brought out a lot of it. And so having these processes in place before that would have caught this before it came to this scenario. So I
For the
appreciate.
last 3 years, at least, it has been the practice of the Public Health Department to essentially tell the administrative office and the county commissioners that what is in the Public Health Department budget is none of their business and they'll spend the money the way they see fit. And I don't think that's practice. And I think that Commissioner Bothel's points are well taken, that there needs to be transparency as to how those budgets are allocated and how those funds are spent, because that was not the case for at least 3 years or more.
Thank you. Is there any more discussion on this? Jody, are you comfortable with the transition that we all understand what's happening there?
Yeah, no, we'll be fine. We'll work together and we'll figure this out and everything like that. And like I said, I know this is a lot and this one's more difficult than I even imagined. The amount of time when I offered to help you guys out, I didn't know how much time I was going to have to spend with this. So I know he has a lot on his plate with COVID and everything. So we'll work with a smooth transition, but I just think it's where it needs to be. And it's just moving forward. I don't want to be making decisions for that department when it's his role to do so. So we'll work together and we'll figure it out.
And Jody, can you get me contact information for Cynthia so I can send that notice today? I'm obviously trying to defer as much as possible to the new county attorney, but since she's out of the office for health reasons, I'm presuming that it's important to get this notice sent immediately.
So
Ryan, do you
Yeah.
still have the same email address for the county?
Do I?
Yes.
Yes, I still receive emails at attorney@riograndecounty.org.
Okay, I do have that. I had been given that through Trish and Tony, so I can send you my information to you directly.
Thank
yeah,
you.
because the contact I have is her SLV HCC email. And so, yeah, it would probably be better. And so that way, if Cynthia can send it directly to you, her personal one, that would probably be better.
Okay.
Okay.
Thank you.
And we still need a motion to transition the fiscal responsibility of the San Luis Valley Healthcare Coalition back to public health, and I would make that motion.
Second.
Okay, I got a motion and a second for the transition of HCC back to the Director of Public Health. All in favor?
Aye.
Motion carries. Is there anything else under public health at this point?
Another question is, now that we have Dr. Bancoli to run the department, we have a resolution that put John in the position to be the commissioner that manages that department. Would it be appropriate at this time to rescind that resolution also?
I personally think that, I don't think so, not yet. I think having that time where Dr. Bancoli can have a chance to have John and everything, not that you can't handle it, but just a second set of eyes on all the contract stuff. I mean, what do you think?
I think it's still a little bit premature to just cut ties with the commissioner that is being overseeing the department. The reason being that there are a couple of reasons. One, I'm trying to figure out so many things. One of them is what we just listened to, and there are some other projects that are like, immense. We probably already know about the CTC. I mean, we're just walking through those, and it's knowledge along with the staff knowledge and the skills. Give me that institutional knowledge to fall. So for now, I think let's keep him, because I need to be talking to somebody at the county as to what is going on.
What I'm seeing is that there's kind of we've got two people in the same role, because you're the director of public health and he's the commissioner managing public health, which is like two people that are. That was where I was coming from, is it sounds like you have two people doing the same job.
Oh, no. I mean,
And
the way I
we
was
need
looking at it was like, okay, I'm in my job, but he's my link person that I have to be reporting to from the county commissioner. He's not going to be doing my job.
Okay.
Yeah, I think we need to leave it set till the first of the month. Maybe at our first meeting in December, we can see where you're at, where your comfort zone is.
And that's fine. I just didn't
If
want
John's
it to
wore
be
out.
forgotten.
But I also want John to also speak out as per what he's comfortable with going forward and how he's going to devolve his role, either limiting it to being just a link from the county to me, or, I mean, John needs to speak out for himself too.
I view my role right now is to work with the public health department and to assist. I'm there to help. I'm not there to direct at this point. And while we go through this familiarization process and we get some of these other grant issues worked out, which directly affect the county fiscal responsibility and the budget going forward, I feel comfortable working with Dr. Bancoli going through all of this. But again, I'm not there telling him what to do by any means. I'm there to assist. And it provides a direct contact to the commissioners so we don't all have to meet to have the conversation with Dr. Bancoli.
Whatever, I just didn't want it to fall off the table and end up in 10 years, we still have that resolution sitting there.
Yeah, we will dissolve that when it's time. So.
Okay, is there anything else under public health at this point? If not, we have a bunch of people sitting around waiting for us. I don't know if, yeah, Jack's still on. Okay, so we move on to county official and department head reports. Did we have something from Road and Bridge today, or didn't we receive one recently?
Yes,
Real quick.
This is real quick. Pat's in the back of the room.
We
Okay,
did
I can't tell. I can't recognize the faces.
well, nobody can
Patrick.
recognize him. He's all covered up.
It was sent Thursday,
And,
per your requirements.
I never got that, so I'll follow up and track that down again from you.
Okay.
Okay, procedural question, is Dr. Bancoli's listed as county official and department head reports also? Is that, should it be under county official and department head, or should that be under public health also?
However you want to pursue it.
Probably in the future, we would put it under public health, as long as we're having regular public health components to our regular commissioners meeting, because in the past, the Board of Health met, quarterly, I believe. And particularly right now, as we're going through the transition and we're dealing with the COVID crisis, it's probably appropriate that we have a Board of Health meeting at each commissioners meeting, and Dr. Bancoli can participate in that and update us as he goes forward at this point. And then after we get through the COVID crisis, perhaps we can go back to a more routine schedule.
Okay. And so I guess you're up again in a couple more items. And so,
All right, I'll sit tight.
yeah, there you go.
Okay, thank you.
Patrick. wanted
Patrick,
to-
are you ready?
He went to make some copies.
Okay. Well, while we're waiting, Jack, we've seen your report. We have a copy of that. Do you want to right quick give us anything you have to say there?
Nothing really. I know Judy is new at this, so I just wanted to set in on this one just to make sure that everybody understands that after you sign that and it's mailed back to Denver, Denver's been having a terrible time keeping track of them. So I've had to resend several, and Bobby's helped me out there by sending me copies of the signed reports. And that's the report that I turn in that gets the county the $1,225 a month. So it's kind of important that we get it in. And I think what I've asked Judy to do is go ahead and have you guys sign it, mail it tomorrow. It's supposed to be to Denver by the 15th, but I don't think that's a big issue. And then email me one. And that way, when Denver says they lost it or can't find it, why then I can make sure that they have it.
Thank you, Jack. Sounds like you've been dealing with the bureaucracy.
Well, I have, and I know how to double clutch them, so we'll get her done.
Thank you.
Okay, thank you. Is there anything else on that particular report that says to receive and approve? So I assume
I
that we
moved it.
need a motion to approve.
I'd move that we approve it.
Second.
Second, motion is second. Any other discussion? If not, motion carries. And then, still, is Patrick back yet?
Back. So you good to go? Ready?
We're ready. Go for it.
So, top of the list, we completed all the storm damage tree limb project that we encountered through October. Our total investment so far is around 120,000. That was unbudgeted for, but we'll figure out some way to pay for it. We still have to cover our cost of the rent on the chipper. Hopefully Jim gives us a little bit of a break because we moved it from location to location for him because he didn't have the capability. We completed all of our paint striping, completed all our Schedule A road agreements, plowed snow for our second storm of the season. Roadside mowing was completed. We attended our local annual HUTF seminar via Zoom. No changes with regards to how we submit the report. We began the engineering work on the Centennial Ditch project, and then we've been working on doing some modifications and repairing to dump body on one of the dump trucks. The proposed work is we'll complete our Centennial Ditch project. We'll start pushing stockpile for our future work that we're doing after the first of the year. And then we could start some engineering work on County Road 29 and the Wagarita Road, both of those. And we had our new contract signed with State Land Board and South Fork Gravel Pit. That format's changed a little bit, but it's been renewed and we are good to go with that. That just has to be submitted back to the state. Things that we're looking at right now, we're right in the middle of our Centennial Ditch project. We set all the concrete structure yesterday. We're in the process of buttoning up the ends, taking care of the mastic, and then we'll start backfilling. We'll have the road open by the 20th with no problem, just as we projected and posted in the paper. So other than that, that seems to be our focus. I have one employee that will be going in for shoulder surgery in the middle of next week. So I'll be down an employee for, we're unsure about how long that's actually going to be. Couple months, 8 weeks, something like that, I'm hoping. So hopefully snow treats us nice, snow's high, not low, and then we'll be able to manage a little bit better. Other than that, we worked yesterday, so we'll be taking tomorrow off as Veterans Day, just so that everything's balanced out. But things are going well in our department. We have interviews next week for I have openings for 2 positions. I had 2 applicants apply. Shocked at that, but I'm tickled to death with 2. So we'll see how that works out next week, and hopefully we can get a couple of young guys on board to help us out. Start getting our workforce back up to somewhere normal. I have basically 4 open positions. I just talked to Debbie a second ago. So I do have the 4 open positions.
Okay,
We're trying to fill them. So other than that, unless you guys have something for us, we're good. I did get my new pickup. I picked it up a couple weeks ago. So I've got it in. We're just on the tail end of all of our payment stuff. We're like I told you the other day, we're over in a few line items. Repairs is one of them. And we still have 6 weeks to go. But as you remember in the beginning of the year, the $33,000 transmission rebuild that we were not expecting came up and talked to us, and we had to take care of that. So that's where our shortfall is there, but we should be able to backfill through some of our other line items to compensate for where our shortfall is right now. We're not in danger any place.
Thank you, Patrick. Are there any other the commissioners have any questions or comments for Patrick at this point?
Thank
I
you.
don't, thank you.
Okay, great. Thank you.
Have a great day.
You too.
Thank you very much, Patrick.
You're welcome.
Okay, Dr. Bancoli,
Yes, sir.
you're back on the list.
So, I mean, being that today is my first time of presenting updates, so I really don't know how you guys really want the updates to be and the areas to be covered. But in interim, my updates is going to be for today, without that guidance. I'm just going to be covering 5 major areas, covering the new updated definition of COVID-19 outbreaks. It just came up, the CDPH, Colorado Department of Public Health and Environment, just came out with the updated definition just last Tuesday. We'll talk a little bit more about the vaccination and the distribution plan. And then we'll look at where we are at currently as a county, in terms of our numbers, in terms of how we're doing. Then I will be advocating for some preventive measures, not a sledgehammer, but kind of encouraging the county citizens. And then also try to inform us of our new initiatives and what we're doing currently. So those 5 areas will be what my updates will be, unless if we have any to add before I start diving deep into each one. All right. So in the past, the definition has been of COVID outbreak, because I realize now that there is now like a second wave of an increase in positivity, increase in the infectious rate. People are kind of a little confused as to what do we actually really mean an outbreak of COVID-19? Or where is the source of the infections coming from? How do we determine that in a particular facility or in a workforce setting, if there's an outbreak, what is the definition? And that has been the discussions among the local public health agencies and CDPH. And finally, they came up with a draft saying if we have in a facility or long-term care facility, residential facility, or in a workforce setting, if you have a confirmed case of COVID-19 in a person, plus 2 probable cases, then you have an outbreak in that setting. That's one definition. Second definition is if you have 2 confirmed positive case, then you have an outbreak in that setting. The third definition then is okay, maybe at the point in time when you did the testing, it is not confirmed. Then what about suspected case of COVID-19? That's okay. If you have 2 probable cases, that is not confirmed yet. It is just called suspected COVID-19 outbreak. That will be confirmed. And all this will have to be within the 14-day window.
Okay, so even if one of those people has recovered, if you have 2 more within that 14 days, it's still considered an outbreak.
An outbreak.
Okay.
The other, going back to that definition again, they updated another definition, especially for living a long-term care facility. In the past, it used to be if there are positive cases among the residents. But now they said, oh, there was a kind of a little loophole right there where we're not considering the staff. So they updated that to say the positive rate could be from the staff, not just only residents. So they updated that language in that one. So I know everybody has been talking about vaccination. People have been anticipating that there's going to be a rubber bullet. But right now, it's not news right now that, there's been a vaccination that has been approved by FDA, especially the one from Pfizer and Moderna. So the way they came out with the breakdown, they said in the next couple of months, starting from mid-December, Pfizer will come out with about 20 million doses of the vaccines. And they'll be upping it up every month until they get up to about a billion, some billion amount of vaccines. And the way they intend to distribute this, it is based on the population size of the state. And Colorado right now is about 1.6%, 1.69% of the total population of America. So if we have 20 million, then 1.6% of that will be coming to Colorado. So they anticipate between 200 and 400 doses that be allocated to Colorado. So tripling it down from Colorado the state and to the counties, CDPHE has come up with a plan to say, okay, across the state, there'll be 10 primary sites where distributions will go. And then on top of that, there'll be 5 secondary sites. So they've not actually determined which sites will be, but that is the original plan. Now, getting down to our region, getting down to our county, I start to figure out what is our capacity to be able to store and receive the vaccine and distribute the vaccine. Okay, during the discussion within the LPHA, we said, okay, there's a form that needs to be filled, which actually reflects on our capacity. Do we have the capacity to be able to store ultra cold vaccines like the one from Pfizer or Moderna, which goes as low as 80 degrees Fahrenheit?
Is that 80
Minus-
below?
Yes.
Okay.
Most of the freezers that we have around, they're like minus 25 degrees Fahrenheit. So there are specific recommendations and requirements. We have the capacity? I don't know yet. There's a form that is due tomorrow. I just got a wind of it just on Tuesday. Wow. And I'm asking my staff, I will fill the survey to show our capacity. So I'm waiting for the answers. So if we know our capacity, and if we don't have the capacity, which entity or agency within the region, SLV region, has the capacity to be able to receive? If they have the capacity to receive, then how is the distribution plan? These are my questions. Trying to protect Rio Grande County.
Do we have a freezer that will, or?
That's part of my questions that I'm asking around.
So you don't know if.
I don't know if we have. I don't know what we have. This capacity. I know we run immunization program, but many of the immunization programs, they have their own capacity. It goes down, the freezer they have may go down to like 40, 45. But this one is ultra cold freezer. So do we have the capacity? Part of the question I should be resolving. If we don't, who we buy? First of all, there's so many things, so many questions to resolve. In terms of, are we part of the secondary distribution centers that the state is looking at? I could be part of that to get the vaccine down. 2, do we have the capacity, or do we have, essentially, do we have that ultra cold freezer to do that? If we don't, do we have the capacity to buy? Sort of questions.
That, would that be something that would fall under a COVID grant?
Yes.
Because,
They even stated here that you can, let's see, just a second.
because especially if we don't already have one,
Mhm.
apparently COVID's the only reason we need it.
Yeah, there's a COVID ELC funds may be used to purchase vaccine storage equipment if the total cost is less than 5,000. If over this, we will need to seek approval from CDC. So goes back to the budget thing too, to see if we have a line item that could cover this vaccine storage equipment. And then another statement says, COVID vaccine purchase order statement of work. Funds may be used to purchase ultra cold freezers, additional PPEs for vaccination clinics, hiring additional staff to assist with COVID vaccination efforts. So getting to understand and knowing what our capacity is like. At that level, whether we have enough staff to do it, we have our own kit and PPE to really implement the vaccination. If not, do we have a line on the budget to be able to do that? These are the things I'll be looking into. So that's about the vaccination. Then the third one is the county's status updates. Everybody is interested in knowing what the numbers are. And there's a new dial that the state has come up with that is so visual that, you get to this side, be able to see where your counties are in terms of the color coding visualization. Blue, green, yellow, orange, and red. You don't want to be in the red. Even orange is a little dicey. So as of today, the report that I got, and also looking at the dial, on the three metrics that we are using to monitor COVID-19, the first one, the 2 weeks cumulative incidence. As of today, we are at 204.7. And that pushes us over to the orange bracket. Just getting us into the orange bracket. But the other two parameters or metrics, 2 weeks average positivity rate is now at 2.59%. We are green on that. We're doing good on that. We start getting to worry when it's like above 5%. Hospitalization, we only have 2 right now in the hospital. And our total case load so far has been, as of today, 165, very recorded. And currently there are active 25 cases. Oh, actually 25 from yesterday. So the reason why we look at the data and the metric, especially the 3 metrics, is to be able to know what interventions and decisions to be made as a public health administrator. Looking at the data that we have, although the numbers are gradually just climbing, but 2 out of 3, and I was discussing with you yesterday, or 2 days ago, 2 out of 3, we're at green. Nothing really drastic going on. The incidence within 14 days period is moving us closer to orange, but it's not reflecting on the positivity rate. What that means is, you get some folks that are on a suspected COVID-19 test to be confirmed, but the positivity rate is coming down. It was 3% before. It came down to 2.8, now 2.59. I won't be worried too much about it. Some people may have been positive before, and when they got retested, after 14 days, they became negative. New ones are coming up. I'm not saying it's not going to change, but as today I'm talking with you, we're in the green on that positive rate. Okay. Hospitalization, only 2 people. There were 4 before, but 2 have already come out. Great. Only 2 are in the hospital. But when you look at the other counties that surround us, Alamosa, Conyers, I'm trying to get the names right, but they are going into the red in all the 3 metrics. There are measures to be implemented when you are between yellow and red. What that tells me, though, is that whatever we're doing right now is working. We need to protect ourselves. But as a county, when you're surrounded by the oranges and the red, oh my goodness, you are not living in a bubble. We are not living in a bubble. So somehow it's going to come in to us. But what can we do? One, to protect our staff, because our staff don't also live in a bubble. They come here to work and they go out into the community, they mingle with them. They don't live, many of them don't live within the county, but they live amongst the people that have yellow and red. So in this case, this is where I start talking about protecting our neighbors, protecting ourselves. And this is when hype up the preventive measures. This is not the time to start talking to the county and saying, you must do this, you must do that, you must do that. No. This is time to now say, you know what? our surrounding is surrounded by oranges and red cases across all the metrics. We are correcting the green. How can we protect the green? Increase our preventive measures by cleaning our hands frequently, wearing masks, social distancing, and at the same time, making sure that we limit our social interaction beyond our households. And we all know Thanksgiving is coming. All the merry making and people are coming to visit us, just like the governor said, and the police said. Let's try as much as possible to do a lot of the preventive measures so that we don't bring it home or give it to the other network folks. So my piece today is to say the data is okay for now, but it could change. I was talking with Judy, I said, you know what? As when I'm making my updates, it is okay for now, so we up the preventive measures. But when things start changing, because you don't have control over what's going on in Alamosa, you have control over, surrounding counties. If we can encourage our staff, our citizens to increase their preventive measures, we can continue to be in green. But for how long? Now to be very specific, looking at this courthouse, my observation has been, and pardon me if I try to say things that probably touches you, but that's my observation. There are three entrances to this courthouse, the central entrance and the two side entrances. Wow, our staff come in through the side entrances. One, there's no hand sanitizer in that place. Well, they just come in, they're going to do their business. Part of increasing the preventive measure will be all entrances to the county buildings should have hand sanitizers at the minimum. Whatever you're bringing in, you clean it off before you get into the building. We should be role models in the sense that we say public, as they're coming through the central entrance, there is hand sanitizer there. So they come in, they clean up. They did that, they wear a mask. What about on the side doors? We don't have that kind of preventive measures.
We had sanitizers for the side doors. At one time, we talked about, they had them, I don't know where they're at. We had them.
I know we talked about hand sanitizer and we got a bunch of hand sanitizer, but I don't know how it's been distributed
There
or.
were stands.
anything.
I know one time there were
Yeah.
stands to where we could have a stand, because we weren't using those doors to begin with. We were channeling everything through the front. But there was enough stuff. I'll look into that too, because
Yeah, that's another
we'll get
observation.
more of them, whatever we need to do.
Yes, if we want the staff to be coming to the site, then we need to put sanitizers there. We want everybody, like you said, if everybody to come through the main door.
Well, and the side doors aren't really accessible to the public because they're locked.
Right.
That's just staff coming in the side.
That's what I said. First of all, protecting the staff.
Right.
We're trying to protect the public coming in and bringing it to us. But what about the staff also bringing it to the workforce environment? So, two options. Everybody got to come through the main door, or every other side door should also have hand sanitizer.
I will, if we don't have those, we'll get them. Whatever we gotta do.
The other piece that I also observed that I think also should be part of the discussion, I don't know if it is being done right now, is that in most buildings, you have thermal temperature measurement. As you're coming in, because hand sanitizer will not tell us if the person that's coming in is sick or not. But the temperature is beyond 99.2 or something, then they cannot actually come in for service. It's a tough call, but I can say that I just put that in the parking lot. If the numbers start rising and we're getting to the orange, we're getting into higher numbers on our metrics, these are kind of key strategic interventions that we start looking into.
And I also believe that we got some thermometers
Yeah, there's several of those that we bought that are around, so.
in public health somewhere.
Then the question though would then be,
Who would be in charge of doing it?
yeah, when we say, okay, all entrances should then, everyone that's coming in should come in through the central door, then it's easier to say, okay, Anyone that comes in, you check your temperature, you come in. But if deciders are not monitored, then I'm just saying all this stuff, we're not there yet in terms of what the data is telling us.
Well, and I guess too, is if the staff is the only ones that are using the side door, is if they come in the front door in the morning, get their temperature checked, then how many times a day do they need to, they don't have to have it checked several times or
only
anything,
once in a
just
morning.
once.
Yes.
And so I wouldn't see that that would be an issue.
Okay.
That whenever they come in the morning, they come through the front door.
That would make me happy that at least I know people that are coming in don't come in with an infection. Or don't come in with something, even if they've not been tested. Because one problem with prevention is you hide your sickness. You come in, or you're not being tested. And testing then depends on if you're actually asymptomatic and they say, oh, you're gonna go home. But that could have been prevented from it. Oh, you're on temperature today. You might want to talk to your supervisor. You go home.
But that's something that we wouldn't implement until we get to Orange? Is that your,
Well, the sanitizers and stuff ought to be out there
The
now.
sanitizers are
Right.
supposed to be
So
out
we-
there, every entrances. And notification as per washing hands frequently, social distancing, that should probably come down to building our facilities to paste on all entrances, little blob notice, wash your hand, wear a mask. I don't think all the building entrances has that notification. It should be.
Should be.
thought they did, I don't
If
know,
not,
maybe we should check.
Yeah.
Because right now it's preventive measures that we need to get into, protecting our staff and then protecting the citizens.
Is that something that maybe Max could do, is just kind of walk around the campus and make sure the doors are all marked right?
That's-
See where we're at as far as the sanitizer stands?
Yes.
If he can make a list of that, then we can go from there and then we'll just,
Okay. Thank you.
yes, sir.
And I had a great meeting with Commissioner Botel about the meeting she had earlier on, that was ended this week, about supplies. That giving me a heads up that the state made it clear that it should be the last resort for supplies. And I took that very seriously, so I talked with my staff. It happens that we have different suppliers. And that we always make sure that we have at least a 2 to 3 week supplies so that we don't run into any issue. And Diane, who is in charge of making a lot of supplies, actually makes a lot of orders. She's ordered a lot of the supplies, PPE, masks, everything. So just wanted to reassure you that your prompt was really noted very seriously. And two, that we've made a lot of orders. And they're all out now, they'll be delivered. So we will not be caught flat-footed. Thank you. Number 5, before I start jumping into initiatives and or whatnot, do we also have any questions on the first 4?
I don't think.
I asked as we went along, so.
Okay, good. And feel free to modify my updates if you want. So I'm trying to just follow suit. So just like last week, a new program was initiated called SHAPS. It's a form of needle exchange program, which is a harm reduction technique known nationally to prevent substance abuse disorder. We all know, I don't want to preach it and waste your time. We all know that substance use disorder is a big deal in most communities, and ours is not exempted from it. And one of the key problems is people using and reusing needles. Not only that, they catch infection or transmit infection. It's a big deal. And SHAPS needle exchange program is a well-recognized national program. So we started together with other SLV regional agencies.
Yeah.
Pardon me, I'm trying to figure out those names one by
You
one.
got it.
So that's San Luis Valley, correct? Yeah. Yes. So we had the first set. I'm waiting for the numbers. And yesterday we also had another set of needed exchange with folks, and I was told it was well attended. Reason why I brought this forward is that I don't know the rate of the substance use disorder across the counties, but from reading the CTC communities that care numbers, it appears we have a higher rate of substance use than other counties in our region. So it's something that we really have to take seriously. So that's my update for now, unless we want to get to the messier one.
Is that all? Is that all?
The messier one, though, one of the grants. None of this is totally oblivious of. The community that care grants, a 5-year grant that is now due for renewal. Actually, renewal this time around is very competitive and is due on the 25th. But the current one that we have, the report that was submitted was rejected. It was submitted was in August. And then, so we are now walk through what the rejections was all about, the delivery that actually lacked. In short, the state wasn't really happy when they were talking with me. We need to work and then revise the report and send it to them. Remember, the first report that was due before September. And then after that, part 2 was supposed to already begun, which is going to be due December 15. We've not even started that yet because we've not cleared up the Cap 1 report. And I just keep it. So we're going to make us good with the state by revising and making sure that our report is accepted. We're going to then fast track the implementation of the Cap 2 to get a report done ready by December 15. And at the same time, try to write up an RFA that is due on the 25th. So everything is being fast tracked. So I didn't want to talk too much about the messier part, but I'm supposed to come in here and tell you this is what we're going to do because of where we are presently. We're going to try to make the state look us favorably because we're going to be working with them on what was missing, deliverables, and what we could do. So that's what I'm going to say right now. You can do it.
Thank you, sir.
You're welcome.
Sounds positive right now.
Oh yes, we'll walk through it. It just, yeah, capacity-wise, there was an increased turnover of a lot of people that seems to aggregate a lot of information to themselves. Now when you don't have the report, I have to be asking the state to give me the report of what was submitted. We couldn't find it. I think a lot of things was shrouded in secrecy. And I asked the staff, they don't know where it is. So little by little, you'll be seeing the specific changes of transparency. And because when you do all those things in secrecy, well, state is not going to be happy because they can look through and see a lot of things. Commissioners would not be able to see how especially are we really meeting the demands of the community. We are all answerable to the community and to our funders. So day by day, we'll be chipping in on stuff.
Thank you. John?
Anything else today from Dr. Bankua?
Yeah, I'm going to be getting back to a lot of the meetings. And the RGCC meeting, I'm going to be joining at 2 o'clock, it's 2 to 4. But before then, at 12 noon, I'm going to be on the call with the variance case manager from the state to talk more about our numbers and or whatnot.
Okay, very good. Well, if that's all for now, Dawn has been sitting there waiting to do her housing study. If we can get past the informal reports and follow up, because I know she's been working. She's got a meeting starting at 11. And so if we could turn it over to Dawn right now with the San Luis Valley Housing Coalition, she's talking to us about the housing study request. Dawn, go ahead.
John, On there, it says informal reports and follow-up. I don't know what that was intended to be.
That was a request to.
I don't know. I think
Oh, sorry. That was a request to be a standing item on your agenda in case there were other departments that did not submit something in writing that you had questions for. So I
Okay.
don't think we have that today.
Okay, thank you.
And I have
Go ahead,
just
Don.
made- Don, I've just made you a co-host, so if you would like to share your screen, you should be able to do that now.
Thank you. Oh,
Thank you.
are you able to see my screen?
yes.
Okay, thank you. So good morning and thank you for having me today. I am Dawn Melgaris with the San Luis Valley Housing Coalition. Jeff Owsley was unable to make it today. He had a conflict pop up at the last minute, but him and I are part of a cohort of individuals who are working on a valley-wide San Luis Valley housing study. We mentioned this to you, I believe, last week or your last meeting in the public comment section. And I'm here today to give you a more formal presentation of what we're doing. So as you can see here, we're looking at doing a study on all 6 counties and 14 communities. The group that came together currently has about 25 leaders from around the valley, and we do have members from every county within the valley currently helping us complete this study. When we first came together, we all had different perceptions of what the housing looked like and what the needs were, and honestly, those were different per community as well. So we quickly decided that the housing study was the quickest and best way for us to get started on helping with housing issues that we were hearing about from around the valley. This housing study will be a comprehensive look at the housing stock. It has already begun with an employer survey back in September that just finalized on this Monday. This study is going to start at the valley-wide, so all 6 counties as one, and then go down into each individual county, and then even further into the 14 communities, which we'll discuss on a later slide. We are going to collect data both from the individuals needing housing and the employers that are struggling with finding employees that are either willing to stay long-term or that are living within the community where they're working so that they're spending their money in the community where they work and live. We will be looking at many different add-on things like what does the homeless population need? How are mobile home parks being affected and what are their needs? Seasonal workforce housing is affecting some of our communities more than other, and what is the housing need for that? And then what is an action plan that we can put together for each of these communities to help the local governments, developers, and housing organizations come up with solutions that will fit the actual need within those communities. So here's the list of communities we're looking at. As you can see, in Rio Grande County, we have picked Del Norte and South Fork to have our deep dive look. South Fork did have a small housing study done about 5 or 6 years ago, but it was very project specific. And we are looking at big picture, not just affordable or rent assisted government housing, but housing in general. So we will be looking from that rent assisted government housing all the way up to high end housing and seeing what's missing, where improvements can be made, and what the community is saying about the housing stock. Any of these communities that have the slash in them, the company we have chosen to do our study has stated that they have a similar enough geography and population that they are treating them as one on their end for costs and outreach. They're close to each other and they're very similar. We felt Del Norte and South Fork were very different communities in lots of different ways, and it was not going to be appropriate to combine those two into one. Oh, I lost my mouse. So our goal with this study is going to be to figure out what each of these counties and communities needs, come up with an action plan on how to help with those needs over the next 10 years, and then to also help as the Housing Coalition and the cohort through the housing study to help these jurisdictions come up with the funding and the plans they need to help the solutions actually come to life. We've heard very often in some of these meetings that there have been housing studies in the past that nobody actually took the data and moved forward with them. A lot of times these studies were done either at the government section or by a developer that was from out of the area, and they just wanted to see if there was an opportunity for housing. And we feel that because this cohort is very localized, everybody is local, and they're all geared towards housing solutions, that we can continue to work for years to come to help the solutions come to light. So our budget for this is very large, and this is because we are looking valley-wide and then the individual communities. So the overall budget is $272,000. We were able to do some negotiating to bring this cost down because it was almost $300,000 to start. And what it means is that each community will cost about $10,000 to have a housing study finished in their community. This cohort has already raised about $153,000 currently to help with this. And we also have applied for a $60,000 DOLA grant with the town of Center that would go to the study as a whole. We've had generous donations from the Colorado Health Foundation, CHAFA, San Luis Valley Health, as well as jurisdictional pledges or donations from the town of La Jera, Antietam, Creed, and Center, Saguache County, Conejos County, and Mineral County, as well as Saguache County and Conejos County housing authorities. We also have funding in the works from El Pomar, the Kerr Foundation, and as I mentioned, the state of Colorado. Currently, we have left $83,877,000, but that does include the possibility of a $60,000 grant from DOLA. If we get the $60,000 grant from DOLA, they are requiring that every jurisdiction that we are looking into help with a small portion of the matching funds that the cohort has to come up with. And that is why I'm making these presentations to county commissioners and individual jurisdictions. And this number is really large, so we kind of want to break it down a little bit and let you know what this would look like if you were doing this study on your own. Currently, to get a study done in a large city or a county, the cost can range from $30,000 to $100,000. For instance, the city of Alamosa is doing a study currently with us, and they are paying just around $80,000 for their study. By joining our group and participating with our study, we were able to bring this cost down to $13,600 per county or town for the overall study from start to finish. But because we were able to reduce costs through large donations, we were able to bring that down again to about $6,100 per community. This is much more cost effective than the $30,000 to $100,000 that each community would be paying for if they were to do this study independently. So what we are asking for currently is we are asking every jurisdiction in every county to help us come up with the $60,000 matching fund that we need to get the DOLA grant. We should find out next week if we are receiving that DOLA grant And if not, we do have a backup plan for applying for some smaller matching funds grants, but either way, we still need to raise the remaining part of our funds. For Rio Grande County, to include the county and the 2 towns, we need $10,000 total. Now, we're not asking anybody for the $10,000 because our cohort is raising funds for some of this, but this is what the total cost will be with the matching DOLA funds. Our group has decided that we would not ask any one jurisdiction to contribute more than $3,000 unless they felt they had the ability to do so. So for example, Mineral County had $25,000 in their budget to do a study on their own, and they have decided to pay their entire county the $5,000. Mineral County also contributed an additional $1,500. So that county is overfunded, which allows us to move some of the grant funding we have done for Mineral County to cover other jurisdictions like Rio Grande and Saguache County who have higher needs. What we are asking for today is that Rio Grande County look at their budget, either the current budget that's ending or potentially their new budget for 2021, and help us fund the part of the $10,000 needed for your county to be able to participate. Your participation will allow us to help the individual communities come up with just a little bit less of funding, especially for the smaller communities with less population and less income. It will also help our cohort know how much fundraising we need to continue to do in 2021 to meet the final need. If we get the DOLA grant, we still have $23,877 to raise, which is to us a small amount compared to where we sat just 6 months ago with $272,000. We are hoping that we can count on Rio Grande County for a contribution of somewhere between $500 and $3,000 to help us meet our requirements for our DOLA matching grant, but are willing to negotiate and have a conversation if those funds are not available so that we can meet our requirements. Are there any questions for me at this time?
Don, if after the study, how does this, how do the findings result in some sort of action?
Yeah, so we have several people on our cohort right now that work for organizations that have missions to bring housing to these individual communities. Obviously, we can't promise which communities are going to get what because we don't know what they need at this point. But we have several members of the cohort that are willing to step up and help, including the Housing Coalition, to help jurisdictions and developers bring in the housing that's needed. We'll be reaching out to developers as well to request donations so they can get copies of this study, because anybody that's making donations will receive a copy so that they can also come forward with their housing solutions that may help what the study shows. The one thing that this study has going for it is that it's well-rounded and it has buy-in from all of the communities, and it's not just going to be looking at one community individually. So we have CHAFA willing to help come in and fund projects. DOLA is excited and Division of Housing are excited to come in and fund projects. USDA is part of our group and they're ready to come in and fund projects. And then there's other funding out there that could, from HUD or other resources, as well as we have the Bank of America and several other larger corporate banks that want to see housing happen in rural America, and the Federal Home Loan Bank of Topeka. So we are already reaching out as a cohort to funding opportunities that can help us fund some of these projects as they come in. Projects do take a couple of years from the housing study to actually breaking ground because that's just how funding typically happens. But this cohort is dedicated to making sure that the action plan be put to use in as many communities as possible. We have organizations like Indie Dwell out of Pueblo that is doing the container homes that are willing to come in and be project managers and help bring those sorts of housing to communities that are in need of smaller housing projects or maybe seasonal housing projects. So we have lots of organizations involved already that are ready to run with whatever the data shows us.
Thank you. Any other questions or comments from the other commissioners?
I don't think I have any.
No, I'm good. Good report. Thank you.
Thank you. And we are happy to come back and report back if the commissioners have any additional questions after this meeting and would like to have further discussion.
Thank you, Don. You'll probably be hearing from us. Now you have 17 minutes to get ready for your next meeting.
Thank you. I appreciate that. I'm on my way there now. You guys have
Okay.
a great day.
Thank
and
you.
Thank you for letting me present today.
Bye-bye. Okay. Before we move to executive session, are there any informal reports or follow-up?
No.
You know, I do have something I would like to say is I know tomorrow is our employee appreciation event. And this was planned and scheduled without my knowledge or input, and I ended up having an appointment that I can't change. And so I would apologize to all of the employees that I'm not able to participate.
Thank you, Suzanne. I understand. Basically, it was put together by administrative staff coordinating with the other departments, trying to get it done before the end of the year. I'm assuming that we have the service pins and things like that already on hand. Is that correct?
According to Deborah, we do. I did check on that 'cause I
Okay.
didn't want to have that again.
Okay. And I may not be able to make it if I'm still running around with this cold that I'm fighting with right now. I'm looking forward to being there. So Gene, you may be the representative from the commissioners to run around and make everybody recognize everybody.
Thanks, John.
Hey, anytime, guy.
We'll talk. We'll talk off
Okay.
air.
Okay. Is there anything else?
You do have
We
some
have
regular business following your executive sessions also. So your commissioner's report and administrator update will follow your executive sessions.
Right. Okay, so if there's no other business, I guess we can adjourn our regular meeting and go to the executive session. Two items under executive session. One under CRS 24-6-402-4-D to discuss specialized details of our security arrangements or investigations pursuant to CRS 24-402-4E for purpose of matters subject to negotiations and instructing negotiators. Specifically, this is to receive a report regarding the cybersecurity services and to consider continuation of the contract for cybersecurity services. The second item will be an executive session for pursuant to 24-6-402-4F, personnel matters specifically to discuss the administrator applicants. So I'll take a motion to adjourn to the executive session. And do we want to take a few minute break here while we get set up for the recording there?
Yes, I would like to take a
I
break.
see a head nod. I hear a yes.
I move that we.
Okay, then I'll take a motion.
I move that we adjourn
Okay.
to executive session for the purposes previously mentioned.
Second.
Thank you. And a second, all in favor?
Aye.
Aye.
Okay, thank you. And we are adjourned. And thank you everybody for participating in our Board of County Commissioners meeting. And you can rejoin us after we finish the executive session, should you choose to. Judy,
I'm
we
going
have
to
the,
pause this meeting and turn off our camera and microphone on this side. So for all of our participants, if
Okay,
you
so you're all-
just check back, you should be already admitted into the meeting. I'm not gonna close this meeting and make you come in again.
okay, what does that mean I need to do, Judy?
You need to do absolutely nothing. We'll take a break here and be ready to go into that executive session.
Okay, thank you. I'll be back in a minute then.
Suzanne said she will text me when you're ready
For it to come back.
to come back.
Okay.
Yes. Note to self, turn on.
We're gonna have to turn this video back on so John can be there. John, I'm coming back, getting you back
Is that new
online.
John?
It's pretty cool. It does look like an owl. Oh, it is called an owl.
Yeah.
Did did you change the sign?
No, I didn't, sorry.
Point it that way.
It doesn't matter. Once you start talking, it finds you.
Oh.
Yeah, yes, all the time.
I'll
And
see.
we are, because we're not recording through Zoom, this is our executive session recording mechanism. So I'm just gonna set this down here. The only purpose of the owl right now is so that John can see everybody.
I am still seeing everybody else on here.
Yes. Yes, you are. They can't see us or hear us.
Are you sure?
They may be able to see
Because I
us.
can see us.
They may be able to see us. I wonder. But, okay, I can go through and put everybody in a waiting room, so that's what I'll do.
Oh, that's